Hello, I am Dr. Vaishakhi Rustagi. I am a consultant pediatric endocrinologist practicing in Delhi. Today I am going to discuss growth in children. As we know that growth is a dynamic process and children grow at a relatively predictable manner, it is important to monitor these children at regular intervals for height and weight. The child's growth can be monitored by plotting the height and the weight of a child on the country-specific growth charts. The height and the weight must be plotted regularly on the growth chart so that we pick up short stature early. Causes of short stature can be genetic, some systemic disorders like chronic renal causes, chronic liver diseases, etc., or it could be hormonal deficiencies. The hormonal deficiencies which cause short stature are growth hormone deficiency, hypothyroidism, and hypoparathyroidism. Parents and teachers are the first to encounter any growth abnormality in a child. The red flag signs in child's growth are as follows. If the child is the shortest in class, if the child is below the 3rd percentile on the growth chart, if the child is above the 97th percentile on the growth chart in height as well as weight, if the child is fitting into the same clothes for more than 2 years, if the child is fitting into the same shoes for more than 2 years, there is slow fall of teeth, and the younger siblings of the family are getting taller than this child. These are all signs to get alert for growth abnormalities in children. If any of these red flag signs are seen in your child, then we must visit the pediatric endocrinologist at the earliest. Once the pediatric endocrinologist takes a thorough history and does a detailed examination of your child, he or she would be able to come to a conclusion as to the cause of short stature. Depending on the cause that is suspected by the pediatric endocrinologist, further test in the form of blood work or radiological investigations would be advised. Yes, treatment is available for most of the causes of short stature. Once the cause of short stature is being found, appropriate treatment would be started by the pediatric endocrinologist. Growth hormone therapy is indicated for only some selected causes of short stature. Growth hormone therapy, though, is a relatively safe drug, but it should only be administered under the supervision of a growth specialist. Growth hormone will only work if the growth plates are open. Once the growth plates fuse, the growth hormone cannot function. So to summarize, growth monitoring is an extremely effective and a cheap tool to check for short stature and act on it promptly.